Ebusia for UK care job no omoba betwem anase say. Health and care worker visa etimi abo ankrofo ama maba UK. Abetena ha say eye adwuma no. Sa enhyehyeye no eba wiye omoba betwem anase dey. Ayeyese na emom atesem so de yemfa anya asem. Eno ti na maba ha say meba be pensem mu meba be biebiem ama wate wo ho ase. Etinya abotre hwe video ni kosi ansa na wa ma comment. Se takrabo no yini ti a hwede hu say yakokɔhwede ansa na waka say yakroma. Ensem ni nyina ene say Rishi Sunak aye Prime Minister of United Kingdom. Na Rishi Sunak ene na pamfo eba aban mu no. Manifesto anase campaign omo ye ya eton krofo akoma so, emerewafo nkokrafo mrantie mabawa, eton mutrim eton makoma so a, emo mutime to abama oba aban mu baako ene say oba immigration obehwe na wasi ano anase wasoso ano, mekire say obe control immigration. Na eno na oba aban mu no ebi mo se wantumi ani ne bohye so, ebi nso se o try ne best akwete say na nado dam kwa kufa do ka say obema one village one dam ya enoko village bia dam ewo ho no sa pepepe na akoye nche bia yenka bi hyemu na MP bia friend Keir Starmer woni Rishi Sunak de chese ekatomamento ewo parliament na nyasem ketwa enchiremu nyina ene se o se Rishi Sunak immigration o ka se obeto so ano no enya de obaye o yes adwuma no mama yenkwohwe sa video nemra.
Most recent sister we had, as the ONS said at the time, contained a set of unique circumstances, including welcoming many people here for humanitarian reasons.
They're not work visas.
The figures are out. It's 250,000 work visas were issued last year. He knows that answer. He just doesn't want to give it. And the new numbers tomorrow are expected to be even higher. The Prime Minister stood on 3 Tory manifestos. Each one promised to reduce immigration. Each promise broken. They all stood on those manifestos as well. But the reason they're issuing so many visas is labour and skills shortages. And the reasons there are shortages is the low-wage Tory economy. Under his government's rules, businesses in IT, engineering, healthcare, architecture, welding can pay foreign workers 20% less than British workers for years and years on end. Does he think his policy is encouraging businesses to train people here or hire from abroad?
Prime Minister.
Mr. Speaker, he talks about immigration, but we know his position because it turns out that Labour would actually like to see even more people coming to the UK, increasing the numbers. That's not just my view, Mr. Speaker. Those were the words of his own frontbencher who said having a target isn't sensible.
Mr. Speaker, they've lost control of the economy, they've lost control of public services, and now they've lost control of immigration. And if he was serious about weaning his government off the immigration lever, he would get serious about wages in Britain and get serious about skills and trade.
Design puni mpuko so wie no ene na Rishi Sunak edin hyehyeye be a friend stop the boat e baaye na eno no wase se we illegal immigrant na obi wrem na yeso mu a ene obeto se table tennis na wakoto okrom se surudu.
We've introduced tough new measures today to help us stop the boats. The new illegal migration bill means that if you come here illegally, you will not be able to stay. You will be detained, and then you will be swiftly removed to your own country if that's safe, or if it isn't, then a safe third country alternative like Rwanda. And we will make sure, like Australia and America, that if you've arrived here illegally, you will not ever be able to return.
So early next year, we will introduce new legislation to make unambiguously clear that if you enter the UK illegally, you should not be able to remain here.
And also answer why the chef for bia batches ni nyina ene say but aye ene say obetimi asoso immigration said the or share ne bono visa cost any health surcharge immigrants omoba kroma se omotua no oba betutumu san hyehyeye no but aye mienu ene wo ho sanse so auto visa fee ni mu na so auto health insurance ni mu a eno ebetimi ama nkrofo kakra bi ene beba eno achi ombetimi raise over £1 billion etimi ama omode akotwetwa ekabia ewo kro ni mu.
So what we have done are 2 things to find this money. The first is we're going to increase the charges that we have for migrants who are coming to this country when they apply for visas, and indeed something called the Immigration Health Surcharge, which is the levy that they pay to access the NHS. So all of those fees are going to go up, and that will raise over £1 billion.
Na before tea we say anya ye dekora essence kuro kakra ye baso ene visa fee mo se mo ba betutum health insurance so mo ba betutum dia na ye say anya ye de Nemum timemufo ne de omo still na it is not enough for them on sanye foforo. And no ena MP fon kabom ko bia your friend the Red Wall Conservatives. Maka omo ho abom di hihye bi ekopem Rishi Sunak. Say Prime Minister afia ye ba beto abesa opesa woni wapam fom sa atena ban mu dia ene hihye ye ebeboa ama watime control immigration ama timemufo no etimi ato abama. Na hihye ye beto odwane menua enya asem ketewa ehuru bobobobobobobo. And no ena me ba be biebiem essence eho ena care job no ehye amanfo hu ye omo se UK for eba betwa care job ni mu enti enya asem bia eba beto dwa se ye ba betwa mu de na emom eye MP for nkabom ko bia omode hihye bia ba se omode kwache Rishi Sunak so pese one na aban mufo etena aban mu dia ene omuni san hihye so na temamufo ntimento abama no enti se ogitum a ene bekwatia ye bebifo na emom anya ntumu dia ene na hallelujah kan hunu se enye law ma pass Nemum eye proposal. Na omo proposal omo trimupo ni nyina nhihye ni nyina ene se net immigration eye about 606,000 no ompese omo te so eba 240,000 na ekamia kwayeti se 360,000 immigrants there omo pese omo sia no se de be omo makrom ha se eno ebetimi aboa ama immigration no aba form eno na omo de akoto Rishi Sunak anim se sanhihye ye ogitum a ene na nchichemu eno omo friend the 12-point plan on immigration and na say conservatives no eno ena me no beka ho asem. Number 1, skilled worker visa any care job ni mu nyina work visas ni nyina opese or reduced by 117,000 na se oko UK visa portal na ko statistics long-term worker visa yes skilled worker visa any care job no enipa over 160,000 ena itimi remu by the end of 2022 that was statistics ni ya na kamia ko yeti say every 2013 ebe nyina na less than 60,000 people na itimi ra UK per year na edru 2020 cry the esan COVID-19 eteba ebe drew 40,000 people and itimi remu na 2021 and say yini tiko sra 2022 crowd and say drew wiemu anesa na say abro 160,000 and no end almost by the end of 2024 sa nkrofo abi rem 160,000 no e BNCBM say 2024 160,000 sabiti menya kwan erem and no almost reduce by 117,000 people na say chiremu a nipa ebetimi erem eye be 45,000 people sa same way say odwen ho say obi be bisa say na so mote so ba 45,000 people on person be rem 2024 no eno e care job for na sem no mo kana dabi all the skilled worker visa na so what statistics are e UK visa portal na sa over 160,000 people no mo be rem the end of 2022 no uchichema ohamu chichemu no over 50% eye care job for no health and care worker visa eye nurse for doctor for ne care job for no omono eburu 50% the aka no eye the other skilled worker any the ICT for no statistics no and that screen any no so we ye the na say skilled worker visa and krabata ba ko efe the health and care worker visa no omo de be rem at the end of 2022 no na omo bro 80,000 people because eburu 50% what you say into the whole thing 160,000 there not just a hono kwano e capture be 80,000 people. It is almost the whole worker visa and so about 45,000 na not just a care job no and nipa bet media be rem 20,000 so 20,000 people no India for ho Pakistan for ho Nigeria for ho Ghana for ho obia e rem bi na ebasa na ubenya kwan aba na ja comment ehye ho anso hwa nhihye etoso mienu a omosade bae ene say skilled worker visa threshold na annual salary threshold no say person ba UK ebe ye adwuma ebetimi employer na wo say ye adwuma obeji aketua be 38,000 pounds nurse for bebre utietima na say annual salary no omoji be 25,000 pounds this oba kroma say ebetua ka be 38,000 pounds per year there eno ene be yedin ama nkrofo bebre etimi ewra krom ha sei na eno so ochiremu a na chese o de san hihye ne ba e be reduce immigration by 54,000 people per year. And she share toso miensa and it's a student dependent role no e students omo de omo yere no na omo kunu no eba omo de omo ma eba dependence no omo ntwa mokura eno kura de omo twama wie eti em wa wasa omo de share san and she yi mu eno so omo say e be reduce immigration by 75,000. And so wow, almost a graduate visa and students here, you feel be graduate visa, Jin never ko ye juma kakra be 2 years be never pesika gu botuma sana be ko kruma wako obetena ha watena no eno so almost omo close and a student enya ho meka so meba krom ha say e basa no so betime reduce immigration by 50,000. Na meka so ma wie so almost share school for ye ba mo ba Afei kra de omo de abetum ni say so we school ni na pese obesua de wo UK a I was all one of the best international students. Me chase first class and second class upper for third class ne pass for there. Enya de benya university correct me aba e wo UK. And no kra anso ho a omo ti say obeba university a wo say school aba select no. Enya one of the best universities. Sa poor performing universities amafo me apply be rera UK no. Omo so be stop omo nyina from bringing international students. It is a wo apply na chese wo di wani che Oxford and Cambridge mo. And so omo say omo ya e betime reduce immigration by 49,000. And she say bebre and omo kan so me brain intimate me mo boss so omo ka bi for refugees ho omo ka bi for humanitarians ho. The last one, a tram is a health surcharge and as a health insurance. Almost a binary na one to move home. And not there, Siciano is £624 per year. And no, almost a binary ebetum aqua £1,038 was I saying.
Migrants were coming to this country when they apply for visas, and indeed something called the immigration health surcharge, which is the levy that they pay to access the NHS. So all of those fees are going to go up, and that will raise over £1 billion.
Now we must say no more the buying it almost said abanye 1,000 is swap. Tumoko £2,700 per year. And it's saying, let's just say your amount 5 years visa. Health insurance in kwa ube 2,700 multiplied by 5. That is going to give you 13,500. 13,500 and I will be as health insurance. O visa cost in my two so the visa cost na ka ho na ekosi be 15,000 na chese won kwa wo ka no. It is a one we yire e na e bad ya na chese munyina mo tam £30,000 and na de akoye visa. That just a health insurance and more visa cost only with dependent no £30,000. Says Sanchi ye ba. Grofon she me sure some person for eba UK because obini will be £30,000 so on a yere e de koye visa e de aba UK. Now and no ebia ebe save health and care worker visa for because care job no omuntua health insurance. Nemo mo person ba has said driver, mason no money, other skilled worker visa, teacher for any construction for near yin there. Let's just a mom and a equama mom. And no crowns so how mama and so ebe be just enkwala mo below 18 years no omono e omotete eso ema wo mo san shade dem nya sure say aban ne budget to me sense ogituma bibini bi anase foreigner bi e be dream pass amafo ebetimi era UK mini anom na chese san yema we say ene kobae se san hihye e na aba amafo say ene omo betwa ka job ni mu ente sa ne mom omo se omo teso no na nya ka job no kwa na omo teso skilled worker visa ni nyina omo teso by 117,000 eno e proposal omo say Rishi Sunak ohwe na want teso said be ya one na aban amafo betimi ato aba ama omo the coming elections. Minua, this is Tips and Gist. Me da